Evening, everybody. This is Brian introducing last week's Future Trends Forum session with Dr. Doris Iarovici. And this was a terrific session. We worked really carefully on questions of student mental health. Dr. Iarovici is a counselor at Harvard University, and she spoke quite movingly and with an incredible amount of information about the student mental health crisis right now. And working with all the forum's questions, she touched on a whole range of issues and topics. There was a great deal of practical advice, a great deal of wisdom, and just overall, I think one of our best sessions in a long time on a topic that I think is of great concern. Two notes before I kick things off. One is a technical note. That Dr. Iarovici was at a location which had pretty uneven Wi-Fi. I tried to clean this up in editing, so you might see a couple of quick jumps or a little unevenness. I hope I got rid of most of the downtimes. Dr. Iarovici was extremely patient, and the forum crowd was very, very kind, and we worked through the whole thing. So I apologize for any unevenness or any bumps. And the second is one personal note really struck me. Doris spoke very importantly to how faculty and staff sometimes inspire or influence students' attitudes towards mental health. And she advised us that a professor or a staff member who exhibits good mental health practices might be a very good inspiration for students, which I took to heart. And then she said one thing is to not work too much, and I'm afraid that I model the opposite. My own work is very, very demanding. I easily work 60-65 hour weeks, and my students are aware of this, in part because scheduling with them is difficult, and they ask about my work, and they see my work when it becomes public. That hit me hard, and I'm not quite sure how to handle it, except to somehow not work so hard, and then to show that in terms of mental health. Well, that's it for the introduction. Now on with this week's Future Trends Forum. Let me welcome everybody. Welcome to the Future Trends Forum. I'm delighted to see you here today. We have a terrific guest on an incredibly important subject, and I'm really looking forward to our conversation. We've been talking about student mental health for quite some time. We've been discussing this in terms of the COVID pandemic dating back to 2020. We've been talking about student mental health services on campus, and I thought it would be really important to revisit it in the year 2025 because student mental health, it seems to be generally acknowledged, is in crisis. Students are having a really hard time with multiple stresses. They're seeking a lot of assistance. Colleges and universities are scrambling to figure out how best to support students. And I thought there's nobody better than Dr. Doris Iarovici, who comes to us from Harvard University, where she is a counselor, and she can tell us what she's finding. And she's also the author of a new book on the subject. So if you look in the bottom left of your screen, you can see a tan button that says Coping on Campus. Click that, and that'll take you to the book's homepage, and you can learn more about it. But without any further ado, let me see if I can bring our guest up on stage. Good afternoon, Dr. Iarovici.
Hi, I'm good. Thank you. And it is taking me a little while to hear you, so I apologize. I'm traveling. I wasn't anticipating traveling this week, but I am. So I hope you can hear me.
Well, I can hear you now. Where have we found you?
Okay. I'm in Amherst, Virginia right now.
Oh,
so,
wow.
It's colder. Yeah.
It is cold. You're not too far from me. Next time, let me know, and I can bring you up to my house, and you can use our signal.
Thank you. Yeah, and thank you for inviting me, and thank you everyone for joining. I'm glad to see that there's interest in this topic.
There is indeed. Doris, let me just begin with a couple of questions, and let me start with our traditional way, which is to ask, what are you going to be working on for the next year? What are the big projects, the big ideas ahead for you for 2025?
So, I mean, I'm primarily a clinician in my day job, so that work doesn't change all that much. But the things I'm thinking about are new challenges that we're seeing that come up in the work. So they're professional development places where I'm going to be looking at. I work with students with eating disorders, and I'm looking at trying to understand the new GLP-1 drugs that have sort of entered healthcare with, kind of flooded healthcare and are being misused by some students. So that's sort of a new challenge that we're seeing. We're kind of seeing new substances come to market or come on the street that are affecting student mental health and well-being. And so I'm going to be kind of learning about the things that seem like they're either completely new or variations of something we've seen in the past. And then also just trying to stay abreast of, the AI explosion in higher ed. And there's a lot that I have to learn about that and just trying to understand it. And so those are kind of my extracurriculars. I do a lot of writing, so I'm hoping to be writing about some of these topics too as the year moves forward. And I think, institutionally, we're all looking at trying to get a handle on things that seem to change semester to semester now. So the pace of change is very rapid. I imagine that folks who work at colleges and universities see some of that too, wherever you all are.
I understand. Well, thank you. That sounds like a very rewarding year. I'm especially, based on your book and my conversations with you, I'm really happy for your patients, the students who get to work with you. I'm also looking forward to seeing more of your writing. Friends, if you're new to the Future Trends Forum, I'm going to ask our guest a couple of introductory questions to get the ball rolling for our conversation. But then I'm going to get out of the way, and it's going to be over to you for your questions. So please, as Dr. Iarovici and I speak, think about what you'd like to learn more about. Think about what questions you have, what comments you have, and if there are any stories you want to share from your own work. So just to begin with, Dr. Iarovici, I'm not a trained psychologist by any stretch of the imagination. So when I hear a lot of discussion about a student mental health crisis or student mental health epidemic, I'm obviously very interested, but also I feel like I don't have the professional bona fides to be able to assess the veracity of that claim. Can you describe this? Are we living through a student mental health crisis? And if so, what does this look like?
I think that's a great question. So I think we've been talking about a student mental health crisis for at least 20 years, possibly longer. And I think a lot of that is based on numbers that we see from studies which track parameters of student well-being. So some of them are self-report surveys. There are some big national surveys. The Healthy Mind Survey is one example. There's the American Freshman Survey, which is another. So there's surveys which kind of ask students themselves how they're feeling, and these have been ongoing for at least a couple of decades. And they show rising rates of self-reported anxiety, depression. One of the items on one of the surveys is feeling so overwhelmed that it's hard to function, and that was an item that was rising kind of alarmingly even like probably 15 years ago, and that was when we first started talking about a crisis. The other data points come from people who work with students, so counselors, sometimes faculty, but there's another large national survey that surveys directors of counseling centers across the country, and they also have been reporting increased utilization rates at their centers and also increased severity of the kinds of diagnosis that they were seeing. Counseling centers traditionally arose to kind of be there for students with what were thought of as kind of everyday developmental needs and also academic needs. And I think what's happened over the past probably 25 years is they've morphed more into clinical centers. And, anecdotally, over the course of my career, I've been working in college mental health for over 20 years now, I would say that I've seen that as well. So, where we were seeing more what might be called homesickness or kind of relationship difficulties, identity issues that are very normal during the college years, we're now seeing more, diagnosable things like depression and anxiety and substance use disorders, ADHD, and, neurodivergence is kind of the new term that I think a lot of people were not familiar with maybe 20 years ago. So we're seeing a lot of what's being called more clinical end of the spectrum problems. I will say that diagnosable problems are still much lower than the percentages of self-reported distress that we're seeing. So I often caution people when we're talking about this topic to think about distress and sort of diagnosable illness as sometimes overlapping, but not always the same. And I think that what we're seeing now that's very challenging is that as students are more aware of their own mental health, sometimes they rush to self-diagnose, and I think sometimes we over-pathologize what are actually normal developmental issues. At the same time, we also still miss, diagnosable problems. And I apologize, there's a big grandfather clock in this room that goes off every 15 minutes, so we're going to get a little reminder of the time. But that's what I think I think of when I think about the mental health crisis. During the pandemic, things got a little worse. And so, we all heard terms like epidemic of mental health problems. Some of that might have been, I think, over dramatized, but I do think again, the numbers of students presenting with significant distress have risen, and that's really concerning. And possibly the most concerning measure that we see is, self-harm or students attempting suicide or dying by suicide. And although I think we've made some real gains there, in the pandemic, we saw increases in these numbers among adolescents. So not college-age students, those numbers stayed steady. But if we think about who's coming to college in the next, 10 years or so, I think we have to keep remembering that the pandemic affected a lot of young kids very significantly, and that rise in the numbers of suicides in adolescents is very, very concerning for those of us in the field.
Thank you. That's a very, very rich answer. You've given a really clear outline for where all this could go. I have lots of questions about the details of that, but I want to hear from the audience on that. But I want to ask you a related question. These students are now on campus, usually in person, sometimes online. What are some of the best ways that colleges and universities can help?
Yeah, it's a great question. And I think we also have to remember that colleges and universities are only one part of the support system. So, we want to think kind of globally. And I think on campus, it's also important to think kind of about the entire community. So not just the mental health professionals on campus, because, I think that there's no way that mental health professionals alone can handle the needs of the student population when it comes to, kind of emotional well-being. So, and some of these ideas are certainly not mine. I also have done some consulting work with the Jed Foundation, which is a nonprofit that focuses on student emotional well-being on campus. But their framework talks about a community of caring. So the idea that everyone on campus, not just therapists or psychiatrists or nurses or physicians, but every person who interacts with a student on campus has a role to play in student well-being. And so, if we're talking about faculty, for example, we also know that mentorship and having a purpose while students are in college are really important to emotional well-being. And I think that's forgotten sometimes when we think about why students come to campus and what they're seeking. But, just kind of making sure that faculty are aware that when students are showing signs of struggle, there may be many reasons for that. Sometimes they're underprepared academically, or there's something going on for them, but also like feeling comfortable just asking questions like, how are you feeling? Are you doing okay? and not being afraid to ask questions that are not intrusive, but that are supportive, and also modeling healthy behaviors. I think that's the other thing. It's not just what we say, but it's what we do. So I think about that in terms of labs, for example, that have students up all night, or some of these are more in the graduate school setting, where we know there's certain mentors that demand kind of 24/7 work schedules from themselves and their students, but students are watching. So if they're kind of stretched physically, if they're not sleeping or eating, their mental health will start to decline. So kind of thinking about those balances while we're working with students, like in the classroom, but then also outside the classroom. So we also talk about, like, on a campus, the bus drivers or the janitorial services folks who have an opportunity to see students living in the dorms, if it's a residential campus, sort of doing basic training with all those folks so they can also recognize if a student seems to be really struggling, and then knowing how to react and how to refer. Some universities have, and I'm sure some of the, maybe many or all of the folks on the call have systems in place where they create maybe like a centralized line where anyone on campus can report a concern, and then there's a trained person who can respond to whatever the concern is, if there's worry about a student. So just having centralized systems that can kind of catch students when they do experience a crisis or are really struggling. Obviously, disability services that interact with faculty and with counseling services are really important too. So putting accommodations in place where treatment alone isn't kind of helping to level the playing field for that student.
Well, this is first of all, thank you. You've just given us another beautifully detailed outline about the many ways that the institution can help.
Thank you. I'm trying to keep an eye on the chat, but I'm not seeing all of it.
Well, don't worry. I'll bring things up from the chat, and then I can share the whole recording of the chat with you afterwards. I love how you've just given us so much to think about. It seems like the whole enterprise of supporting students' mental health is such an all of the above total mission for everybody who works on campus. Before I could even finish that, we have questions coming in. So here is one from our good friend in Connecticut, Roxanne Riskin, and she asks this: first responders to me are often the educators, but thank you for the reminder that it's everyone's awareness for student well-being.
Yeah, absolutely. And I mean, I think, we can say that more generally, like we all should be looking out for each other's well-being in our other communities too. But I think campus communities give us a more concentrated community. And I see, this is sort of related. I see someone else is asking about mental health of online students. And I think that's the challenge. We're trying to figure out how to, first of all, just even track online students. In the institutions I've worked in, there isn't anyone who's entirely online. We have some students who are taking hybrid classes, but there are physical touch points with them. I think schools where your population is only online, I think we're still figuring out how to monitor. I think that's going to depend more on whatever community they live in, and maybe figuring out ways to partner with their families, or if they're in roommate situations, kind of making sure that there's some outreach to communities that they live in, so that there are other people kind of keeping an eye out if they're, having difficulties.
Well, this sounds like a very, very different sense of community, one that's much more caring. Thank you for that answer. And as always, Roxanne, thank you for your question, as well as your focus on well-being. We have questions coming in from all over the place now. And here's one from UC Santa Barbara. And this is a question from Mindy Collin. How can the average college staff or faculty member best learn about signals of student distress versus student diagnosable mental health issues?
Yeah, that's a fantastic question, and I spend a lot of time in my book actually trying to talk about that because it's not there's not one way, and it's not a slam dunk answer. Um, but I think there are certain warning signs that you can look for that would indicate that there might be a diagnosable illness going on. So I'll just talk about some of the very basic ones, but the answer is much bigger than we can really get into today. Um, so, if you notice obvious signs of like hygiene failures, for example, it looks like someone maybe hasn't showered in a few days, or they're wearing clothes that are atypical for them. Again, it's always measured against what their baseline is. So, we wouldn't, it's not any particular way that they might look, but if they look different from how you're used to seeing them, or they're suddenly not showing up to class, and this is someone who was pretty regularly attending class. If there's something in the way they speak that you suddenly, you can't understand, so when people are starting to get depressed, they may say things that don't fully make sense, or, if they seem more suspicious, or, anything like that, those are signs that there could be something more serious going on. If they talk or write about suicide, that's always a flag, obviously. But I've had professors identify suicidal risk in students just by something that they had written, and approach the student and then ask for help. Or sometimes they approach us. So there's someone on your campus who you can always consult with, I imagine. But those are the kinds of things I look for. If someone is suddenly very withdrawn, or the opposite, if they're suddenly, someone might be getting manic and just talking all the time, talking out of turn, you can't control their behavior, anything like that that seems out of the ordinary in those extreme ways, should get professional attention quickly. But I think those are the difficulties that we all run into, and I think it's made harder now by what's on social media and what young people themselves are exposed to. So, there are now all these TikTok videos that sort of teach students how to self-diagnose, and a lot of them are actually very inaccurate. So then it gets really complicated, because you may hear about the students themselves complaining of things because they've identified with something they saw online, and there have been actually studies published about this that show that when physicians look at the content of some of these videos, it's like about, I think, 50 to 60% is just inaccurate. But it sends the students themselves into disability offices, or into my office, kind of seeking a diagnosis when sometimes it's not there.
This is I've heard this. It used to be referred to as Dr. Google, and now we have Dr. TikTok. So we have things like TikTok Tourette's, for example. But first of all, Doris, thank you for that excellent answer, and thank you very much, Mindy, for the great question. We have more questions coming in. I'm going to try and organize them into a kind of flow here. And there's one from Leslie Harris at Bucknell University, who asks about a particular kind or particular set of mental health issues. What are some best practices ways of dealing with substance abuse issues on campus? Excessive use of alcohol, drug abuse, etc.
Yeah, that's a great question too. So in general, we use harm reduction models. So we again, generally, there are instances where we would probably use more of an abstinence-based model, but that's not where we start. So there are a variety of good programs. And approaches that colleagues at different schools have come up with. For example, for cannabis, there's a really nice program called Tea Break out of University of Vermont, I think it comes from, and it's available free. It's an online program that students can kind of download, brochure that describes how to basically just take a break. Tea break stands for tolerance break. So the idea is, can you go a day? Can you go a week? Can you maybe go 3 weeks without using cannabis at all? And it has a whole bunch of steps and instructions and information about what to look for. And we sometimes use that model with other substances as well, depending on how significant the problem is for students. But I think what we run into with, bright college students is that they often think that they don't have a problem, and they often think that whatever the substance is that they're using, that it's non-addictive, and that they're certainly not addicted. And sometimes that's just not true. So the other approach that I think can be really helpful is based on social norms. So there's often a misperception among students that everyone's doing it, right? So they over generalize. And so if you have data for your own campus in terms of like how prevalent alcohol use is or how prevalent cannabis use is, you can use that data with individual students to kind of help them see where they fall on the spectrum. And often the numbers are lower than they think it is. You know, and same for severity of use. So for example, a student may be using cannabis daily and say, well, like that's what everybody's doing.
Mhm.
But daily use is actually not that common at most schools. It's more common than it used to be, for sure. But just kind of helping students start to see that their peers are not quite using at the rate that they think they are. And also, just showing them data from like the National Institute for Drug and Alcohol Dependence that show like how many drinks is considered alcohol dependence for a man, how many for a woman. Some of those norms are based on age.
Mhm.
I think that the other place that we are catching up in the medical field and is that, we have so many students now identifying as non-binary or transgender. And a lot of the data that we have is normed by gender, especially with substance use. So sometimes we run into difficulties there as well, making sure that it's relevant to the students we're working with.
Mm. Wow, this sounds like a whole session that we should do just on this topic. There is an awful lot going on here. Leslie, thank you so much for bringing this question. And Doris, you are a wealth of information about this. We have another question from closer to your neighborhood. This is from Emerson College. And we have a question from Elena O'Malley, who asks, did you already address the specific considerations of how to help students of color, those with a variety of disabilities, and first-generation students? So I think you mentioned some disabilities, especially neurological issues. But if you want to say more about all that, please do.
Yes, thank you for the question. And I have not addressed that yet. And again, that I think could be a whole hour discussion and probably longer. I think that's definitely contributing to the increase in utilization of our services, or the increased need maybe, because we know that students with different demographics don't always use services at equal rates. So there's students that are sort of hesitant to come and use counseling services. And for many reasons, we know that also international students are frequently utilize mental health services at lower rates, but we know that people from traditionally underserved populations do as well. And some of that also has to do with representation and feeling like they can go into a counseling center and see therapists and psychiatrists who look like them and will understand them. We like to think and hope that all of us, if you're sort of well-trained and sensitive, you'll be able to understand students from wide variety of backgrounds. But I think it's still reassuring to students when they see themselves reflected in their clinicians or their choice of clinicians. So I think schools have been trying to make sure that their clinical task force is really well-trained in issues of racial trauma and LGBTQ issues that have been coming up, and issues of international students and students with disabilities. I think it's an ongoing. I think that those topics are not like sort of a fund of knowledge. They're more about attitudes and constant learning. So I think that there's also continued room for all of us to do better. I also, we live in a political landscape, right? So there are changes coming. We saw a lot of efforts to broaden inclusivity in the higher education realm in the last few years. And, that's a whole other, I think, stressor for students is there were efforts at DEI initiatives that, we're just sort of starting to make some headway. And now we've seen kind of a backlash, and we're seeing universities being penalized or, services kind of struck from the university sphere. And I don't know what's going to happen over the next 4 years, but we can surmise that that will continue, and that has, a big impact on mental health for students. And I want to point out that it's not just it obviously impacts some students more than others, right? So we know that we have populations that are particularly vulnerable. So they're clearly populations who are vulnerable, but I think it actually impacts all students because it creates, a sense of fear and confusion. And, my colleagues who work in states where staffing has been cut and funding has been cut talk about the challenges. I think, in disability services, work closely at my institution with the counseling center and, with the academic services arms of the university. But they're also sometimes, in certain, well, probably across the board, they're also stretched thin. So sometimes there can be quite a wait for students to get what they need. There's some students who are more skilled at advocating for what they need than others. I will also say that the transition to college is a particular moment of vulnerability for students with disabilities, because often in high school and before that, the family is very involved in helping students get accommodations and interfacing with disability services. But on college campuses, that is no longer the model. So I think that we all need to be mindful of how to help students learn to become their own advocates. That's a really important moment when they first in that transitional space. So how do they become the ones to talk to disability services and learn to ask for what they need? So I don't know if that answers your question.
Wow, I think this is terrific. Thank you so much for that rich answer with so much stuff, Doris. Stuff, that's a technical term. Elena, I'm so glad you asked the question because this is vital. And again, you've hit on some themes that we've been addressing on the forum for years now. We have a quick question which turns to one aspect of higher education, but I think this may really connect with your point about advocacy. Amy asks, do you recommend that a high schooler disclose his mental disability when applying for a college?
That's a great question. I'm not sure, honestly. I think maybe it depends on how it has affected them, and like where they're applying. I think it's probably they would get a different response at different institutions. And, in my work with, when I've done consulting at different institutions around the country, I think some are very aware of mental health challenges and and understand sort of the ADA and what we can and cannot sort of discriminate against. And then, but not all schools do. And so I don't know that there's an answer I could give that would be relevant across the board. I would say that, it should be a case-by-case decision that a student makes with their family and their doctor, and maybe like if they have access to a college counselor, someone who knows the institutions that they're applying to. Because I'm not convinced that there isn't ongoing discrimination against students who disclose. I'd like to think that there isn't, but I can't tell you that there isn't. I guess I would caution students against making, like, what we have seen, as I hear from, my colleagues. I don't have anything to do with admissions or, work with the Office of Admissions, but I have, faculty friends and people who have worked with admissions before. And I hear that, that students sometimes make their entire application about like a mental health challenge they've had. And my sense is that there have been so many of those in recent years that it's not maybe the best strategy for someone. Like they may want to talk about, what they're like as a student or other if it's like one part of their overall presentation of themselves, then I think that that's great. But if that's the only thing they talk about on their college admission essay, again, because I think there's so many of them, it may not work in their favor.
Doris, thank you for such a candid answer. I really appreciate your nuance in that reply. Amy, thank you for such a great question. That really, I think, maybe I'm wrong, but it seems like what you're discovering in this exchange here is that we've had a rising tide of interest in mental health diagnosis and care, and we may be in the middle of that rise, and we may have more to come. We have a very a question from here from the University of Manitoba from Lashin Pirwani, and this is a question that comes back to the institution. How can institutions balance their expectations of educators addressing student mental health with providing robust mental health resources for the educators themselves? Thank you for sharing your insights.
Thank you for that question. I think that's a good reminder. Like we all have been living through the last 4 or 5 years, and the higher ed space is a tough place to be, at least in the U.S. Tougher than it was certainly when I started my career. It just feels like there are many more pressures on us all, and I think that it's like when we're on an airplane and they say, like, if there's an emergency, put your oxygen mask on first and then help the person next to you. I think of mental health like that too, like making sure we're also taking care of ourselves. And I think that, educators should never feel like they're being asked to be clinicians. That's not your role. When in doubt, always reach out to a clinician and we can kind of consult or help figure out where a student needs to go. And I would say also just, make use of your community also. So, we work at universities, but at least in my experience, sometimes we're siloed and we don't know what the resources are even on our own campus, or at least I don't always feel like I do. So just, just as we tell our students to make sure they're like sleeping and eating regularly and taking days off, making sure that we're doing that too. I think there's some irony, and I've worked in spaces where we're telling students to take breaks, and then my colleagues and I are not taking breaks. So it's sort of being aware when that happens, that it's happening, and saying, I need to leave my desk. I need to like go out while there's still some sunlight. Just going back to basics and taking care of ourselves too is really important. And then remember, you're also modeling for students. I think faculty that take a break, or that take a weekend off or take a vacation, students do notice that, and I think it gives them permission to also take care of themselves.
Just personally, I'm a very bad influence that way, I'm afraid. In all seriousness, I show an overwork persona. Nasheen, thank you so much for that great question. I really appreciate the care that shows. And Doris, thank you for this answer. We have a related question. This comes from Purdue University. We have Dean Ron Friedman, who asked a question from a different angle. My colleagues and I often express concern about students feeling entitled. How should we address this air of entitlement during a time of serious mental health issues? What a question. Great question. I love that clock story. It's so warm. Thank you.
So I think it's almost done. That's a great question. And absolutely, we do see students who, we might call entitled. I sometimes when I find myself reacting that way, and I do for sure, I remind myself that that's their best attempt at getting what they need. And some students maybe haven't learned to do it in a more effective way or a way that isn't off-putting to others. But I guess the other side of entitlement, when I think about it, is that some students, especially if we're thinking about accommodations, we know that some students are better at trying to get accommodations, even if there isn't necessarily a clear diagnosis. Or, as an example that I often talk about, we're seeing this explosion in students self-diagnosing with ADHD. And these are students who have never had any earlier issues. And we know that ADHD is a neurodevelopmental problem that begins in childhood. But we're now seeing sort of an explosion of students, and there's data from pharmacy records, there's data from the CDC that bears this out, that adults who've never had an issue are now presenting to counseling centers or to their faculty. And and they're very adamant, and they often come in telling me that they know their diagnosis, and they also know the exact medicine they need to take, and they often are suffering, and they're often struggling, and there are often other reasons for it that are not ADHD, but they don't really want to talk about that. And so when the demand for a particular thing is very loud, it comes across as entitled. And I sort of take a step back then and remind myself that they are having a problem. It's just not the problem they think it is there. And then I'm trying to basically truth tell more, because I think sometimes we're very cautious in what we say to students. So I find myself more and more saying that there's very little evidence that what you're saying is going on is actually going on. And here's what we know. We know that ADHD has to start in childhood. We know that this is how it presents. Yes, we do. The diagnosis is sometimes missed in childhood, and I have seen that as well. But we do have a sense when that happens that it's happened. There are all kinds of factors that can lead to someone not being diagnosed. And, people from certain backgrounds may not be diagnosed at the same rate. So we're aware of that. But students are also aware that if they say certain things, they'll get certain other things like extra time on tests or extensions. And so it can be very difficult when someone is pushing hard for something that they want to continue to be compassionate and respond compassionately. But I think it also goes back to self-care, right? The better that we are taking care of ourselves and making sure we have time to take a breath and take a break, I think we have more patience to deal with those issues as they arise. And I do tell, we have students call us in the middle of the night for a refill on a medicine that they could have gotten, the day before, or that they could get the next morning at 8 a.m. And I think that there's also a tendency for universities to try so hard to keep students happy that we sometimes go to
I would like to have a word with that center's ISP and IT people after this. You were giving such a fantastic answer. I want to thank you. That is, and I want to also thank our friend Dean Friedman for asking a really challenging question. We are down to our last 9 minutes, and I want to make sure we get to as many questions as possible. And now we have two that are technological questions. So one comes from, I'm going to mispronounce your name. I believe it is Q Quay, but please forgive me if I mispronounced it. And Q Quay asks, I'm curious as to how we support the mental health of online students who may not have access to the same communities and resources as residential students. I think we touched on that in the beginning, but I'm just wondering now that you've laid out the landscape, if you could speak a bit to what's different for online students and how we can support them.
Yeah, it's a great question, and I feel like I'm less qualified to answer that because I haven't directly cared for students in a completely online community. And also the sort of the available evidence we have on that is thin because it's a relatively new phenomenon. But I would say, to the extent that you can, just being sensitive to the same things in online classrooms. I will say that I hear from my friends who teach online that, and I don't know, you all can tell me, is this still happening, but that students will join, classes with their picture off or their mic off, or stay with the just sort of stay anonymous in the room. And again, this is just my impression. I could be, we need more data on it, but my impression is that that's not a good way to conduct a class. That and it's causing, the other thing we're seeing is just tremendous social anxiety. And I'm thinking of it as different than what we call social anxiety disorder, which is something that we've seen and diagnosed across time. But the generations on campus now are just much more socially anxious across the board in like real life settings. And I think it comes from lack of experience, right? Especially for kids who will be coming to college now, if they've missed out on a couple of years of being with their peers, they haven't had that developmental opportunity. So if they're keeping their picture off, I would just gently nudge them to turn the picture on. And it also gives you an opportunity to see if they're actually paying attention rather than doing like 3 other things in the background.
Yeah.
Because I think that continually divided attention is also like not good for any of our mental health. So, as an online educator, I think that would be a way that you could also monitor how people are doing, just actually being able to look at them.
And that gives you a sense of their baseline, their clothing,
right,
and so on. Well, thank you. In the chat, our good friend in Armenia, Brent Presley, says he insists that students have their cameras on during remote classes because engagement goes down almost 100% if the cameras are off. I have a similar experience. Some of my students will display only a picture of themselves rather than themselves. Great question, Q. And here's a related question. In fact, let me take 2 questions and smush them together. This is one from, oh gosh, I'm going to mangle this thing. I believe Vigene Demeki from Edinburgh Napier University. So we have at least two Scots represented here. And Vigene asks, does your research examine the extent to which AI is used for self-diagnosis? Okay, so hang on to that question, because then George Station asks, is there a role for remote human or chatbot counseling support? So, bringing those 2 together.
Yes, thank you. Those are great questions. And again, it's a growth edge for me. Like I'm learning about that as we speak. I've been trying to read more about it. And my understanding is that there are companies that claim that there is evidence that AI-assisted chatbots are effective, but I haven't read all the evidence, so maybe there is evidence out there. But the one paper I did read did not impress me, and I think that there's probably going to be a role for AI and some of the driving students toward resources, because it seems like no matter how many times we tell students that the counseling center exists, or we think we're putting out information, there's always students who don't get the information or say they weren't aware of it. So I think AI could be fantastic in disseminating information. But in terms of treatment, I'm a little bit more skeptical. And I think that part of what, this is again my personal opinion. So just to separate it from like evidence-based opinion, I just think that the human interaction is so important for our mental health. Like I think it's biologically important. We're wired, like we're mammals. I think we were designed to be like keeping each other's bodies warm in a heap on the, forest floor. And so we've moved away from like that level of it, but there's something that happens in the human to human interaction that's necessary for like our health and not just mental health, but especially mental health. So I think that to replace that kind of interaction exclusively with AI-driven technology is probably ultimately not going to be that helpful. I think there's a role for it. So for example, again, there are things we all can learn maybe more passively, or, interacting with a non-human device that's information-based, but then there's that interaction. We know, for example, psychotherapy, the most important factor is the what are called therapist non-specific factors. So it matters more than whether you're doing like cognitive behavioral therapy or psychodynamic psychotherapy or other kinds of psychotherapy. The technique itself can be important, but even more important are factors like, is the therapist experienced as empathic? Does the therapist seem to care? Does the therapist listen? So I think that speaks to our need for the human-to-human connection that, I don't see a chatbot having, but I could be wrong.
Well, I appreciate again your candor, Doris, and I appreciate the questions that came in. George Station always asks great questions. We have time for one more question from one student, and this is from Alba Geronimo from Colombia. I can't put this on the screen. This is from the chat, and she asks about. Let me see if I can pronounce this correctly. Benzodiazepines. And she asks, when students face mental health issues and are prescribed with benzodiazepines, are they good or bad? I read a paper saying using them for over 3 months can cause brain damage. What do you think? That's a very precise question.
That is, and thanks for joining the forum. So I don't think any medicine is good or bad. I think it has to do with how they're used and when they're used. So benzodiazepines can be very helpful in certain situations, severe anxiety and other kinds of settings. I mean, they're used in the operating room, for example, to help people enter anesthesia, and but they're addictive. They're a class of medicine that can be addictive. Again, it takes time to develop addiction, and then they have certain side effects which can interfere with like learning and memory. So there's no like one answer. I think it depends on what we're treating and who we're treating and for how long. But I think in the right setting, they can be very helpful. Low doses, short times, under physician supervision, so that it's clear that someone isn't misusing them or using them for the wrong reasons.
Well, thank you for that very, very concise answer, Doris. And Alba Geronimo, thank you very much for asking your first Future Trends Forum question. We're always happy to have students here, but we are always sad when we run out of the time. Our hour has just passed, which is remarkable. Doris, Iarovici, I have to thank you for several things. First, for putting up with your local Wi-Fi. Second, for answering our questions so beautifully, so thoughtfully, with such care and a huge amount of knowledge. Thank you so much. What's the best way for people to keep up with you and your work going forward? Are you on social media? Do you have a newsletter?
Thank you. I am a little bit on social media. I'm not great at it, but I do have a website, and I answer, if people write to me from the website, I try to answer all messages that I get there. It's just, I think you've included it somewhere, but it's just the www and then my full name.com. And yeah, I'd be happy to hear people's thoughts, especially if you have feedback after our discussion. And yeah, I hope people take a look at my book and let me know what you think of that too. But thank you for coming. Thanks very much for inviting me, Brian.
Oh, my pleasure. I'm waiting for the grandfather clock to chime once more. Everybody in the chat, please let me know. I'd like to post excerpts from this chat to my blog, because this chat has been just tremendous with a lot of stuff going on. Doris, please have a great time writing, and I look forward to seeing you next time. Now, friends, don't go away yet. I need to just let you know where we're headed next. I do want to thank you all for these great questions. This seems like a terrific subject for us to return to. If you'd like to keep talking about this huge range of topics about mental health, please, we can keep talking on the socials. Use the hashtag FTTE if you can. Right here, you can see my handles on Twitter, LinkedIn, Mastodon, Threads, Blue Sky, and of course my blog. If you'd like to dive into our previous sessions, take a look back at our archive, tinyurl.com/FTF archive. If you'd like to look at our sessions coming up on all kinds of future of higher education topics, from high school graduates to free speech to climate justice and reforming grading, just go to our forum website, forum.futureofeducation.us. Thank you all so much for your questions. Thank you for your comments and your patience. I hope everybody is well, mentally as well as physically. Those of you who are enduring cold, I hope you stay warm and dry. Take care, everybody. We'll see you next time online. Bye-bye.